be about working on the neck. We're going to go through a sequence of stretches to start out to open up the tight muscles around the neck. And then we're going to move into some different positions and different movements that will help to create length and decompress the areas along the spine, create some space for those nerves to come out without anything leaning on them or impinging. And then we'll end off the sequence by doing some moves to strengthen the muscles in the neck so that we can keep the head back in that good posture that we like. And the muscles are strong enough to keep that decompression, to keep that open position. And we'll start out with just a really simple chin down to the chest. Let the arms drop down by pressing the palms down into the mat on either side. And then slowly start to rock the head over to the right, down through the center and over to the left. The most important thing about trying to get a really good opening through your neck is to settle your shoulder blades down. If your shoulders are up and you try to do this, you'll notice that you don't get quite as much of a deep opening through that area. When you settle the shoulder blades, it elongates your trapezius muscle, and that's usually one of those muscles that gets really tight in the neck. Once you come over to the side and you find something that's tight, push the opposite hand down a bit more and do some very tiny rocking movements. Making sure that it's just a deep stretch, that you're not getting any kind of numbness or tingling or any kind of shooting pain. Come back to the middle and do the same thing over to the other side. Find that tight spot, push down through the opposite palm. A little rock with the head side to side. Any of those symptoms that I was talking about, any numbness, tingling, shooting pain, anything sharp, is a definite no, because that's telling us that there's something going on with the nerve. We don't want to mess with that. Rock it back into the middle. And bring your head up. One of the biggest problems that we see with people is that their head tends to be forward, and that puts a lot of tension into your neck muscles, because when the head is floating out over the front of the body, these muscles have to get really tight and short in order to hold all that weight from the head. So we practice tucking the chin back and doing a little lift in the back of the skull. So we don't want to do this to the point where the neck gets totally straight. We want there to be a natural little bit of a curve in our neck. It's supposed to be a bit concave. But we do it to the point until the head isn't floating outside the front of the body. And you can use your ear as a reference point. You want the bowl of your ear right over the top of the center of your shoulder if somebody's looking at you from the side. And you can practice that a few times, just pulling the chin back, elongating the neck, but not going all the way into a flat neck. We want to keep that natural curve. Okay, then let's drop the head over to the right side. Take your right hand onto the side of your head and just rest it there gently. Don't push down on the head. Take your left palm and press it down into the floor. So that's going to open up this space in between the side of your neck and the top of your shoulder blade. And then we'll take the left arm out to the side and just reach out through the fingers. Get as long as you can, create space in the left shoulder joint. And we flex the wrist and reach the fingers up toward the ceiling like you're pressing the palm out into a wall. You'll feel some sensation down through your wrist into your hand. And as you exhale, start to lower it down very slowly. And we'll straighten through the wrist, reach through the fingertips as you go down. And then once the fingertips brush onto the mat, we're going to hold it there. Try to walk the fingers away to create more length through the neck. Release your head, come back up into center. And we'll do that on the other side. Chin back, tip the head over, left hand comes onto the side of your head. And just take a breath there, let your head settle into it. Right palm comes to press down into the mat. Open up that space between your neck and the top of your right shoulder. Inhale, take the arms straight out from the shoulder. Reach out through the fingertips. Spread the fingers as wide as you can. Bend that wrist and press the palm away. Open through the fingers. Feel that sensation all the way down into the wrist. You're working on opening up the pathways that the nerves travel through. Start to float your hand down, straighten out through your wrist. Reach out through your fingertips until they brush the floor. And try to walk the fingers out along the floor as the head continues to settle over to the left shoulder. Take your inhale, come back up. Okay, now we're going to sweep both arms up. Create a lengthening up through the crown of the head so that there's this decompression through your whole spine. Take your exhale, drop the right palm down, come over into a side bend. And we'll start by turning to look up toward the ceiling or toward the top hand. We'll drop the bottom shoulder, and we just rock the head gently side to side. And this isn't so much a deep stretch, it's more of reprogramming our muscles to not hold tension when we do these movements. So a lot of people, when the arms come up over the head, the neck muscles get really tight. When we rock the head side to side and try to soften, we'll retrain our muscles so they don't have to grip. See if you can deepen your side bend. Take your next inhale, come back up to center. Exhale, left palm down. Side bend over to the other side. Turn your knees up toward the ceiling. Gently start to rock the head, looking down and looking up. One more time. Take your inhale, come all the way up. Reach up through the crown of the head, draw the chin back. Exhale, right hand down. Come over into your side bend. This time left arm goes out to the side. We're going to turn the thumb down toward the floor. Slide that arm behind the back into a bind. That bind is going to naturally draw your shoulder blade down and create space in the neck. And then I turn my head and look down at my right fingertips. Breathing into those tight muscles in the neck. The head side to side a few times. Go back into that stretch, turning, gazing down at your hand. Release the left arm, open it up to the ceiling. Inhale back up into center. Exhale, left palm down, over into your side bend. We'll take the right hand out to the side, drop the thumb down, slide the back of the hand onto your lower back for a bind. Roll the right shoulder back. Turn the head, look down at the left hand. Create that space from the base of the skull here down to the top of the shoulder. So you're trying to draw it down and back as you go into the bind. And after you take a few breaths holding that stretch, you can rock it side to side. Go back into holding the stretch, opening up space. Take your inhale, come back up to center. Exhale, down into the heart. So that was some stretching to open up those muscles. Now we're going to do a few movements to decompress. And I'll start out down on my back. Take a careful roll down. And as I place the head down, I'm just tucking my chin slightly, getting that curve in the neck, but drawing the chin back so that there's space through the back of the spine there. And I'm going to interlace my fingers and cradle the back of my head with my hands. I'm going to take the thumbs right into the base of the skull, and you'll feel that there's some tension in the muscles right where the skull and the spine connect together. That's your occipital ridge. I'm going to dig my thumbs into that area just until I feel a good, comfortable release. A little bit of trigger points there. And then I'm going to lift my head just an inch, maybe half an inch up off the floor. And rock it side to side, just a few inches. I'm not even going toward the end range. It's just a gentle movement to break up that holding. Okay, come back into center and we'll do a nod up and down. And all of this movement is just done with my arms. My neck is totally relaxed. Rock side to side. Rock forward and back. No pain with this movement. So now, use your thumbs into that occipital ridge and create a little bit of traction, like you're pulling the back of the skull out and away to create space in the back of your neck. And then we'll place the head down and release the arms. So let's roll up into sitting. And we'll come over onto hands and knees, or not onto hands and knees, onto the feet, so that we can take the hands onto the back of the head in the same way. Interlace the fingers, take your thumbs right into the base of the spine at the occipital ridge. And I'll do the same movements upside down, a little rock side to side, a little rock up and down. Like a little figure 8 kind of movement. Just as long as that doesn't make you dizzy. So if you have anything like vertigo or any other kind of dizziness related conditions, this might not be the best position for you, so you would just want to do it down on the mat instead. A little bit of traction with the thumbs into the occipital ridge, create space down along the spine. And then release the arms. Just give your head a little shake, yes, and shake now. Let the weight of the head hang. Create that traction. Alright, now I'm going to bend my knees and slowly bring myself down onto the mat. So we stretched the muscles and we decompressed the area in the neck, but now we need to strengthen those muscles, because if you're having issues with pain and tension in the neck, that's your signal that the muscles aren't strong enough to do the work that you're asking them to do. So the first one that I like to do is strengthen the trapezius muscle, and we're going to do that by drawing the head back and drawing the arms and shoulder blades back at the same time. You're squeezing the whole upper back in the back of the neck. And then we drop the head, push the arms out, and stretch the trapezius muscle. Inhale, head back, chest open. Exhale, push out. Just alternating between contracting and relaxing and stretching those muscles. This is really good for creating circulation back there too, because when the muscles get tight, they're not getting the circulation that they need to function properly. One more. Squeeze and press. Open the upper back, drop the chin. And we'll come back into sitting. So now let's go down onto the back and do kind of a similar movement. Roll yourself down. Bring your head down onto the mat so that the neck is long. Take the elbows down right into your sides. We're going to lift almost like we're coming into fish pose, pushing the elbows down, lifting the upper back, and you can roll back on your head just a bit so that your upper back is lifted, and you'll feel the muscles in the upper back and the muscles in the neck contracting, but not creating so much tension that you can't create a smooth breath. And one more breath. And on your exhale, relax. Rock your head side to side very gently. Make sure that the muscles haven't started to grip. push the elbows down. Roll just slightly toward the back of the skull until you feel all the muscles in the upper back and in the neck activated. Exhale, release down. Good, and we'll take the knees in toward the chest, rock yourself back up. So the last one that we're going to do is rabbit pose. And this is going to depend totally on how you feel, how your neck feels today. For some people, you might want to skip this last one. If you're not really moving away from pain and away from tension yet, you might just want to stick with the stretches. But if you're trying to work on your strengthening, you can take the crown of the head onto the floor, the very top of your head, that flat part of your skull. And then you're going to take your hands onto your heels as you roll forward. Good. So what you're trying to do is draw your belly in. So you're pulling some of the weight out of your head. There really isn't a whole lot of body weight from my body down into the top of my head. My hands are holding onto my heels, so it's creating this opening through my back. As my head moves forward, it's stretching through the neck and through the upper back. But I also have to work to stabilize the muscles around my neck. Roll yourself back, come into child's pose, rest your forehead on the mat, rock it from side to side. And come back to center and lift yourself up. So that was our yoga therapy program to work on the neck. Hopefully that has taken some of the tension out of your neck and it feels a little bit better now. Thank you for joining me. Namaste.